it is something we all have in common. We all have our senses, and it's not this huge lift. I'm not trying to talk to you about this one sex act. I'm trying to say, what does your body do when it loves something, and what does your body do when it doesn't?
A few weeks ago, I had the most incredible opportunity to speak at Yale School of Medicine, yes, that Yale, about the neuroscience of touch and havening techniques. And it was the Women's Mental Health Conference. Obviously, May is Mental Health Awareness Month, so it was perfect timing. And I was surrounded by the most incredible doctors and researchers and practitioners and teachers and therapists and women. And during that time, I had a chance to witness some of my fellow speakers in action. But one talk, my friends, that pulled me back like no other. Menopause and mental health. You know where we're going. From intimacy and relationships and sex and sexuality, and yes, how to break the silence, and even lots of statistics that stopped me in my tracks. And you know, I do this for a living, so it takes a lot to stop me in my tracks. So, I had to walk right up to Dr. Juliana Hauser and I said, I need you on my show. And here you are. So I'm so
Oh, I'm
glad to
so
have
happy.
you.
Thank you so much. And it was so great meeting you there. I'm really excited about this conversation with you.
Yeah, this is a great conversation. And we were talking last week about this. And I said it was so hard to get you alone because for the first 15 minutes that I was trying to talk to you, you were actually talking to my boyfriend, Chris. So obviously, this isn't just a topic that resonates with women, it's partnership too. Like, how do we understand our partners? How do we show up for them? How do we understand ourselves? And I think that's really where I want to go is that whole idea of our own sexual agency and really truly discovering it and having understanding of it. So let's go there because these topics are happening, Juliana. Like we're seeing more people talk about menopause, which is great. But what makes Dr. Juliana different?
Hmm. I I think two parts of this. I, as a therapist, was sitting here and a part of the law of the conversations, and a part of like the big people in this space. And I was talking about sexuality, which I love to do, and it's a big part of my work, and it's been a big part of my research for 20 years. But I kept sitting there thinking, but what about mental health? But what about mental health? And my worlds often collide, but sometimes they don't. And when I started asking about it, like, can I speak? Can I have a talk that's just about mental health? I didn't have as much receptivity to it. And it was often put as like a sentence. It was a quote. It was and we have to think about our mental health. And to no fault of anyone, that's not a criticism to what was happening. It was a noticing of this is missing, and it's a critical part, and it's mental health is often left out of a multitude of topics. Same with sexuality, but mental health in general. And I started thinking, if we are speaking about tips that are helping with our quality of longevity, super important. If we are talking about how to make our quality of life better, I'm so thrilled that we're speaking about this in perimenopause and menopause. But if women aren't able to get off the couch because they are paralyzed with depression, if they are considering suicide or not knowing what their self-worth is anymore, if they are riddled with anxiety, then we're not going to be able to help them with any of these longevity tips because they're suffering too much. And I wanted that to be one of the first things that we talk about. I wanted it to be hormonal replacement therapy needs to have a very different PR, which has happened already. And I think mental health needs a new PR spin too. So I wanted to speak about that. And I find myself often in the taboo spaces and speaking about the things that other people are maybe afraid to say. And I'm not really sure why I feel comfortable doing it, but I guess I've developed a pretty thick skin in the sexuality space. And so I'm willing to go there. And I don't myself see it as taboo, but I know that mental health and therapy still has a stigma attached to it. Not as much as it used to be, but still does.
Isn't it amazing that we actually have to put this in a category that we're calling taboo? I mean, Last year, when I was speaking at a podcasting conference, I was asked to be on a panel that was about taboo topics. And one of the taboo topics that I was talking about was trauma. And I'm thinking, why are these taboo topics? Like, this is the kind of conversation we should be having. And yes, even what you're talking about with perimenopause and menopause and women's health and mental health, it is not something that we've been talking about a lot. Probably in the last, I would even gather to say what less than 5 years it's really been starting to be talked about in this space, but still taboo. Like, why do you think that is?
We have a cultural problem with bringing people in to the problems that we have. Um, in lots of ways, it still is viewed as impolite, or they can't help us, or they've tried talk therapy and there's been a limit to how much help that it can do. I think that it's also been not very affordable, and the system to get a therapist can be very difficult and very trying. And if it's not something that you're hearing a lot of, if you're not seeing a lot of, or you haven't had a great experience with, it remains in that taboo and difficult to talk about space. I also think that there's, we have lots of confidentiality, ethical guidelines in therapy, which is really important, but it's also, I think, added to the perception that it's taboo and secretive. And we have a lot of secrets surrounding it. Although once you get inside of the therapeutic world, it's not that case. And if you have the right fit of a therapist, it isn't that case. But I just think it feels that it's in a different world. It's not as accessible, and that keeps it there.
Yeah. And for someone who's been doing this for over 20 years, like you said, you've been doing all this research as a therapist and someone who's really been holding space for clients and patients and serving that community, you go a little further because, as I mentioned earlier, it's not just about menopause and perimenopause. You are getting into deeper topics like intimacy and relationships and sexuality. You even have a book coming out, which is called A New Position on Sex, which I love to play on words, but that seems even more taboo, because now we're really talking about the intimacy that happens behind closed doors. So, what was your reason for wanting to go there as a therapist into the world of authoring a book?
So I'm not really sure what made me feel again comfortable in the sexuality space. In some ways, I'm a pretty unlikely person. Except for when I look back on my personal life, I was just always curious. And I had this one story of my one class in sex ed in seventh grade that I was so excited about. And I asked a question, like we were able to all write down an anonymous question. And I was so excited about my question to be answered. It was wonderful. And I have this thing, if I'm caught off guard, my face turns red. So I didn't want that to happen because then everyone would know what my question was. And I put this little fold differently. And when it came to my question, the teacher looked at it and said, "Oh God, that's inappropriate." And she threw it out. And even though no one knew it was mine and no one knew what the question was, I felt this horrible shame. And the question was, what's the deal with vaginal discharge? Which I think is so cute that my seventh grade self wanted to know what that was. And so bizarre that that was considered inappropriate. And although I can't say that that's when I thought, oh, well, I'm going to change that in the world, I do think that's where it began. And I think it began like there's nothing wrong with asking questions. And it took a long time to figure out what the deal with discharge was. So that wasn't a great thing. So fast forward to later in life, I had a lot of years of education as a therapist, and I only had one elective class on sexuality. And when I was in that class, I loved it. I was so excited for every lecture. And my classmates, who I loved so dearly, they were bored in it. And my professor took me aside and she's like, every once in a while, someone like you comes along, you need to go into sexuality. Like you're known for that. Like you can just tell you have a comfort level. And so So I started studying it, and I realized, I started first with college women, that women were really, really hungry to talk about who they were as sexual beings and to figure out who they were. And then when I opened up to other genders, I realized that women were hungry and men were desperate. That there was even less of a sacred and safe space to figure out who they were as sexual beings. And I wanted to change that. And then of course I extended it to all genders, and I learned so much. I've gathered thousands and thousands of stories and listened to so many people talk about who they are and their questions. And for me, what I wanted is I really wanted to, like the premise of the book, and what I've done for 20 years is I want to normalize that sexuality is the essence of who you are. And the phrase that I say a lot is, it's the final frontier of self-development. So if you want to know who you are as a sexual being. And if you know who you are as a sexual being, then you know who you are. And that statement sometimes feels very strong and feels like it is too much. Like we're going too far with this, but it's because we're not given the right information about what sexuality is. And once you understand it holistically, then you understand why it's the expression and the pathway to the essence of you.
Yeah, love that. And I think about so many times when I was younger and really was inquisitive myself and curious and asking questions. And I feel like the only thing we had to compare it to or had as a guide was a Judy Blume novel or, Are You There, God? It's Me, Margaret seemed to be where we would go. In fact, I remember when I saw the movie, I was like, oh my God, I'm totally Margaret.
Yes.
I'm like, "That's me." All the questions, everything, and I'm like, "That was the '80s, and who knows what it was like in the '70s and the '60s and every generation before." We just didn't talk about it. We were in closed circles, yet you go back to, like, biblical times, it was like women in the red tent, it was open talking about things, so we got away from it being normal, right? And we got away from it, and it's taboo, and you don't talk about it, and here we are starting to talk about it again, not just in women's circles, because like you said, it's all sexes, but being comfortable being who we are as sexual human beings, right? So going there is so important, and this book is going to be just one of many uh, um, companions that I imagine people can have that they can go to and find that they're not alone in the battle. And even calling
Hmm.
it a battle kind of seems,
Hmm.
not alone
I
in just
think
being human, you know?
Right, and it's. I mean, I think battle can feel accurate, and a lot of ways it's a fight with figuring out who you are and kind of sifting through all of the negative messaging that we're given and lack of information, and then I think it can feel like it's very foreign to have agency just in general, and to be able to have the space and have relationships and have a culture that wants you to learn who you are and then learn how to live the terms of who you are, which is how I ultimately define agency. And you put that skill set within the context of sexuality, it you have to work hard to get to that place, and that's one of the reasons why I say it's, if you want to know who you are as a sexual being, because it's a very difficult place to reside, and we're not given a lot of safe spaces in which to do so.
So, how does someone who is very uncomfortable with this and this topic really, how can they do that if there's not a comfortable feeling in getting to know your sexuality?
Hmm. So the first thing is to release your first thoughts as to what I'm talking about. So everything, every stereotypical thing that you would think of that I'm going to be talking about sexuality, you release yourself from. And the first thing I like to do, and so I have 9 pillars of holistic sexuality that I've come up with based on a 1981 version of it that is outdated. And the first one is sensuality. So my story is, and so the second thing is that, so you release yourself from the stereotypes. And the second thing is listen to other people's stories. Sometimes where you learn you aren't is a great way to learn where you are, and don't be afraid of the differences. And then sometimes hearing your story or something new can be an entry point. So I always look in sexuality, look for your guardrails and then look for your entry ramps into it. And so see if the story I'm about to share feels like a guardrail or an entry ramp to you. So when I started thinking about sensuality as a part of sexuality, a lot of times they're interchanged, but they're different. Sensuality is truly just the how you relate to 5 senses. And not everyone has access to all five senses, and not everyone has the same access to the five senses. But once you start figuring out your relationship with all five senses, it makes a very big difference in two things. One is it creates a mind body awareness. And that is a really key part as a underpinning for who you are as a sexual being, is having mind body awareness. The second thing is that we all have relationships of yeses and nos to our senses, things that are like, oh, that's a yes, that's a yes, that's a yuck, that's a no for me. And when you become brave enough to say, this is a yes, this is a no for me, and are listening to how your body says that, it begins a skill set of agency that you grow into other places. And I haven't even talked about sex acts. Here I have been talking about sensuality this whole time, and that's usually the part that people are most afraid of or feel most comfortable, as they think I'm going to go straight to sex acts, what you're doing with your body and with whom you're doing it. And I was like, no, that takes a while for us to get to that. No, we're talking about other things first, and sensuality being one of them. And I love this story. So when I started hearing about sensuality, I thought, oh, well, that is for a woman who is in Bali, and she has long flowy hair, and she wears long flowy skirts, and she talks like this, and she has this, and I was like, and that is not me. That's not how I look. That's not how I talk. I mean, I could put that on. My hair is actually naturally curly, but I was like, but that's not me. So I'm not a sensual person, because I was equating a very narrow place of what sensuality meant in sexuality. I also used to act, and I was in an acting class, and we went around the class, and the coach asked us what would be the most scary scene that she could ask us to do. And I was the second person to go. And I was like, oh, having to seduce somebody. And the next person went and said, like, they kind of looked at me like, what? And they're like, murdering a child. And then the next person was like, incest. And it was like all these huge things. And I was the outlier. Like, why in the world would I have picked seduction as the worst scene for me to do? And so I knew, I was like, oh shit, like I'm gonna have to do this now. So she's like, Juliana, go over and seduce Price. And I couldn't do, I mean, I was awful, and I did no idea how to do it. And I was 30 at the time doing this, and had already been married and had a child. I had, in a lot of ways, thought I knew who I was as a sexual being. But what I discovered in that, even though it's in the context of acting, was that who I was as a sexual being was performative, and I didn't know how to get into the authentic part of who I was. And so when she came to me, she's like, you got to fix that, like just go ahead and fix it. And when I sat with that statement of you have to fix it, I was thinking, what is the it that I'm trying to fix? I knew there was something wrong, but I didn't understand what the combination of that was. So bringing that story to the story of what a sensual being is, I started wanting to know who I was. And I wanted to know who am I for who I am, not as performing for anybody else, not trying to be the right kind of anything. And I went back to that image of who I went to immediately as a sensual woman, like the right kind of sensual woman. And I thought, okay, good for her. I love her. Have friends just like that. And they are very wonderful in their own right. And I thought, so what's Juliana's brand of sensual? And I went on a mission, and I went into lots of yucks and yums. I went through all five of my senses. And I let myself have the permission to be like, no, yes, I don't know. Maybe if I did this. And I just kept doing it. It was a very brave endeavor. It was not an easy thing to do. I did it by myself. And then I learned to do it with other people, and I started teaching people how to do that. And I realized, oh, there's something to this, because it is something we all have in common. We all have our senses, and it's not this huge lift. I'm not trying to talk to you about this one sex act. I'm trying to say, what does your body do when it loves something, and what does your body do when it doesn't? And it gets to be very different. So that's the beginning.
That is so interesting. And the fact that we are talking about learning about it in acting class, that's my background as well. And I feel like I truly learned more about body awareness in acting class, and some of it was scary. What a really interesting story, and I love that that's what you share so openly. So thank you for being vulnerable with that. I do want to mention the book real quick. It's coming out when, Juliana? When is it coming?
September 23rd.
Yeah. So, I mean, you got time. Are you going to do pre-order on it?
Yes, yeah, we'll be
Exciting.
doing lots of starting it out and telling
Definitely.
people about it too. Yeah.
Well, let's just mention that real quick. I'm going to mention the name of the book. I know there's a lot of stuff that you're doing, but since we've been talking around the book, it's called A New Position on Sex, A Guide to Greater Sexual Confidence, Pleasure, and Authenticity, coming out in September of 2025. And this is a really, I mean, I read a lot and I have a lot of people on the show that have books and I love reading fellow authors' books. This is one that might hit people a little differently, even if you have like one takeaway from it, right? Are you sharing client stories in the book? Yeah.
Yeah, so I share the problem of
Mhm.
why I think we have to prioritize. I don't think sexuality should be a luxury; it
Yeah.
should be a necessity. And then I get into the 9 pillars, and in the 9 pillars, I teach you what they are, and then I tell personal stories, I tell client stories, and that with their permission and changing things, and then I give sex exercises, and then I end it with prompts to ask yourself with it. And then I've added a QR code at the end of each of the pillars so that you can hear other people telling their story. Because the book is actually based on a course that I've been doing for about 20 years.
Yeah.
And
Let's talk about that.
part of the course is we go through these pillars
Mhm.
and you write stories. So you write a story of celebration, a story of healing after we've gone through the content and shared it. And I think it's very powerful to hear other people's stories because when people risk take, and a lot of times if you do this in a group, all it takes is one person to say the hard thing, and then other people feel like they can say it as well, and so I went first and I did this kind of one-sided vulnerability, which is really difficult to do. I had to really sit down. I had a running document as I was writing the content of the book of all the stories I was sharing about myself, and thought, okay, so this is what people who don't know me are going to know about me without us being in a relationship. And I was like, am I okay with this? And some days I was like, absolutely. Other days I was like, what are you doing? And, you know, and I was like, oh, my poor children are going to read this. I was like, my mom's going to be the first one to read this. And then I thought, people don't have to earn my vulnerability with this subject matter right now. And I need to go first so that other people will have the bravery. And then I also thought it'd be helpful for them to, because as much as I tried to be as inclusive and diverse in the stories and the perspectives, I can't capture everything, but I can do more. And I also think it's really powerful to hear it. So I'm very excited to see how people interact with the QR code in the book, and we'll see if people go from the chapter to listen to the audio messages from those who have already done the questions.
That's a great idea. So the QR code will take people to personal journeys, personal stories of those who have worked with you, have worked through the 9 pillars. And like you said, it reminds us that we're not alone.
Yes.
Everybody's story is different in their own
Mm-hmm.
right, but when we come down to it, we're all just walking each other home in some way or another, right?
Mm-hmm. Oh,
Yeah,
it's beautifully
I
said.
love that.
Yeah.
I did not make
Mm-hmm.
that up. Those are not
It's
my
beautiful.
words.
Well, well
That's
timed.
either
Well timed.
right. I love using that. I think it actually comes from Ram Dass, the great spiritual leader, who I think originally came from Rumi. So it goes way back, and I do want to credit, but I do use it because it really is a reminder that we're never on this journey walking alone, and we're all walking towards something greater, higher knowledge. We want to existential, whatever it might be for each person. But when we realize that we're not in it alone, it makes it a little easier, doesn't it?
Mm-hmm. It does. It does.
I want to touch on something that you just said, and I was going to bring it up, but you just actually mentioned it, and that is, how are the kids, as a mom, or even our parents in the role, able to see Dr. Juliana Hauser as this sexual therapist, talking about sensuality, sexuality. How is it for your kids to be like, yeah, my mom's a sex therapist?
Right. Yeah. It has changed through the years. My son used to be asked this, or like if I do interviews, they would ask him for a quote. And I think one of my favorite answers that he gave was his senior year in high school. He's 26 now. And when he was asked that, he said, you know what I learned from my mom was not just how to treat somebody that was going to be in my life. He said, my mom has taught me how I deserve to be treated. and it was in direct relation to being asked about the sex therapy stuff. And I'm not even sure I did a great job in teaching him directly about sexuality. There's a part of me that was like, did we have those talks? God, I hope I did. Like, I hope I practiced what I preached. I mean, he was my first kid. I didn't know what I was doing in a lot of ways. And we've had those talks now too. And I would say now, I mean, he's older, so he has a different come from, is he feels protective of me. But he also feels well positioned to not be afraid to have those conversations with me or with partners. And that makes me feel really good that we have removed the taboo-ness, and I feel really good about that. I think that making there be space for us to have conversations, like there's not just one sex talk, like having a multitude of those. And frankly, the older it gets, it almost feels more important, and there's even more at stake. My daughter is mortified, and
how old is she?
She's 11.
Well, that makes sense.
And yes, yeah, and she's just the most precious thing, and she doesn't want to talk about any of that. We went for we did these barefoot walks around my neighborhood, and I started talking about it, and she could just tell I was about to go there, and she's like, "Oh, don't do it." And I was like, well, I really want us to be able to have this conversation. And so my son was he wanted to hear it all. And my daughter isn't there yet. But what I have seen in her, and again, so if we're having agency, everyone gets to have their own relationship with the subject matter. I'm not going to push my way onto her either. What I have said to her is, I want us to I want us to both practice so that we're both comfortable in having these conversations. And I've said to her, I'm just as nervous about having these conversations as you are. And I want to be the best mom I can be for you when you have something where I need to show up as my best self. And if I don't practice with you ahead of time, I may not. And that helped her to get a little bit more open with it. And she had a friend over sometime this year, and they both had the same, it was an American Girl book about their bodies, and they had sticky notes and they had highlighter pens, and I was like, okay, so her way to get information is independent study, and then my job for that is to be someone who asks questions and she can ask questions too, whereas my son was not going to read a book. He just wanted to absorb it as we went. And I feel like that's a metaphor for how we all need to be, and we all need to be gracious with how we are. There's so much about sexuality that has a right and wrongness to it. If you feel uncomfortable about the subject matter, then you're not wrong in that. That doesn't make you wrong and not a sexual being or wonderful or beautiful and that kind of stuff. It just means you're not comfortable. And I don't think there is a level of comfort that makes it the right level. I just ask people to give a sacredness to the space in whatever way feels right for them.
It reminds me a lot of Esther Perel's books, Mating in Captivity and State of Affairs. And I remember how, and I know you know those books, but I mean, she's just such an amazing relationship therapist. And the whole idea of it's not wrong if two people are on the same page and having the conversation. And it's really not wrong if they're on different pages either, but it's like you really have to meet people where they're at. And I know agency is something you talk about a lot. You actually did a TED talk on it, a TEDx talk on it. And if we could just be more like that, I think conversations would be more welcoming, and there'd be more compassion and empathy if we just realize it's really not only about what we think, but meet people where they are so that there's a comfort. And like you said, safety is always the most important thing. I'm totally hearing your daughter going, Mom,
yes,
please stop. I'm pretty sure I did that too. I'm pretty sure. Well, I was like, ew.
Right. Yes.
That's so great. So do you want to mention what the 9 pillars are? Or is that kind of a surprise that you...
Oh, no, it's not a surprise.
Tell me,
no.
like briefly, just what are the 9 pillars that you go through?
So it starts with sensuality, which is the relationship with the 5 senses. And then we talk about health, like wellness and fertility. So it is your overall sexual wellness, and then it's your whole fertility journey. So from the beginning of puberty all the way through like your death, like what is your hormonal journey, and lots of things that follow within those 2 things. Then next is pleasure. and then we move to desire. Then it is the thing that a lot of people think about, which is sex acts, so acts and interest, and then intersecting identity. So intersecting identities is a pillar, but it's also threaded throughout each one. So this is the who are you and how does that intersect with this topic of sexuality. But I wait to get to that until we're further into, like, until we're past, the sex acts, because it's such an important part of knowing who you are that I like people to have the practice of the method of which I go through each of them before we do it. And then we go back and you put your intersecting identities into sensuality and what your experiences were in the wellness space and so forth. Then we move into power and trauma. And then it's relationships and connection. And then in the hub of it all is agency.
Love it. Great. And you've been practicing this for years, using this with your patients in your own practice. And now those who are not able to work with you privately will have this beautiful book that can offer that. But you also have courses as well. You speak a lot as well. So there's always a way to get in touch with Dr. Juliana Hauser. I'm going to be putting all that information in the notes of this podcast episode. If this episode, touch, moves, and inspires you in any way, consider downloading it, writing a little review, paying it forward to somebody that you might think would really benefit from this. Maybe it's a mom trying to have a tough conversation with their daughter. Maybe it is a friend that just hasn't figured out how to really have these conversations, even with their partner or even themselves. So there's always a place that this conversation really could benefit somebody. And I hope that it is touch, moving, and inspiring you. So, moving into one area that I love to do with this show, I do a little thing called rapid fire. I call it the brain candy game. And basically, what I've been doing during our time together is I'm writing down words that Juliana has been saying. What I would love for you to do is just come back with the first word that comes to mind, little word association. So, are you ready?
Mm-hmm.
All right, let's do some brain candy. Here we go. Taboo.
Off limits.
Sexuality.
Necessity.
Sexercise. Love that.
So fun.
Permission.
Self-guided.
Senses.
Gorgeous.
Menopause.
Complicated.
Stories.
The meaning of it all.
Motherhood.
Joy.
And I don't know if I said this word. I can't remember if I said this one or the other one. Sexuality.
I said necessity.
And okay, so then sensuality. I can't even read my own handwriting.
Yeah. and I answer gorgeous, but I think the answer I would say now is yummy.
Oh, yummy. Okay, we're going to stop right there. Well, that's the thing. Like, you could be thinking one thing 30 seconds prior and then do it again. And once in a while, I repeat a word because I can't read my handwriting. But that's basically where brain candy is. Our brain is constantly like, do, 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 do. So I love that.
And I was thinking about the first one you asked me was taboo, and I said off limits. And that's so interesting that I said that because it's the opposite for me. I'm often like, oh, if that's taboo, then I'm even more interested in it. So yeah, that's great. A great exercise.
Yeah. And I'm wondering, like, taboo for you, when I think about going back to the little girl that asked the question, is it curiosity?
Right. So true. Yeah.
But like when you're put on the spot with stuff once in a while, like the word, you're like, oh, I wish I said that,
Right.
But yeah, it is a fun game. I've been doing brain candy for a while. It is a lot of fun. And it's fun to see what guests say when they've been the ones that have been saying these words.
Yeah, that's great. Yeah, that's brilliant. Yeah.
Awesome. I'm so glad you enjoyed it. All right. So what I would love to do is just ask you, is there anything that you would love to share with Holistically Speaking listeners, or even those that are watching on YouTube? How would you like to leave this conversation with them?
I'd love to go back to the start of how we met, and what I guess a background is I think we shared something really special at that event, and it was really exciting to be at Yale, to be at the School of Medicine, to be around women who were saying mental health and women matter together, and to be able to have to be around other experts that were caring about those topics, because they're not often together and they're not often prioritized, and it felt. It felt really special, even like when I spoke before you, and I stayed wanting to see your talk, and wanted to, like, even interact, through it. And I loved the way that you were presenting your work. And I would say in my work in the many topics of mental health or menopause or the other parts that could be considered taboo, what I have found is women are so powerful when you work together. And I think our ability to connect with one another is what helps our longevity. And we've shown that. I think that we're really good at connecting and creating those networks for ourselves, and that we do think that's one of the reasons why women are living longer. I would love for the younger generations, for there to be like the main skill set of how do we work together, and how do we work it together and have differences? Like with my work in agency, one of the things that I found is being empowered is a lot of where we're taught to stay as women, like, let's be empowered on this topic. And I absolutely believe in being empowered. You have to know what your voices are. But what I've learned about agency is that there's a difference between agency and empowerment. And empowerment is individually focused, but agency is relational. And I think when women get this right, when women get the relational aspect of agency in a place of having their voice, so when we can all find our own voices and all know what our yeses and nos in all areas, next to another woman who has a different yes and no and a different set of voice and what they're needing, that power is absolutely unstoppable. And I encourage all of us to practice agency.
So I'm going to ask you one more question. We're not doing we're not doing the game anymore, but what would your comeback word be for agency?
Life-changing.
Yeah. It is life-changing. It really is. I mean, you just saying that and then coming back with life-changing. I'm sitting here and I felt it right here, because I'm thinking it truly is. Like, who am I? How am I showing up in the world? What do I want to be on my epitaph, or how people remember me? But less about what people remember me for and what I can do while I'm here in the time between the bookends. You know?
Yes.
It's really about that, and connecting with others where we're really part of a collective. We really are, you know? It's so beautiful. I love that, Juliana. Thank you so much. And we're going to share everything about you. I'm going to put it in the podcast notes about the book, A New Position on Sex, your courses. Any way for people to get in touch with you is going to be available, because I have a feeling we'll be sharing some more stages together. I have a feeling.
Love that. That would be great.
Right?
Yes.
Love that. You find your people and you want to stick with them and see how we can make a change in this world and help people to find ways to find their own agency and make changes in their own lives. Great. Thanks so much.
Oh, thank you so much too. It was just a joy to speak with you.
You too. All right, my friends, if you are looking to get in touch with Dr. Juliana Hauser, you have come to the right place. I'm going to share everything that you need to connect with her, whether it is learning more about her upcoming book, her courses, or even just connecting with her on social media. Everything will be in the notes of this podcast episode. And we talked a little bit about havening techniques. You know, it is my jam, and I love to share all about the neuroscience and the benefits of touch. I'm going to share more with you about upcoming havening happy hours. You know, they're monthly, they are free, they are online. You are absolutely welcome. Or if you're interested in bringing havening into the work that you do, or even in your personal life, my upcoming trainings to get certified as a practitioner, all of that will be in the notes of this podcast episode. And of course, you can connect with me in my new Substack or even the Brain Candy newsletter. It's all there for you and for the taking. And I want you to remember, because this is something we talked about a lot, is about agency, about really getting in touch with who you are and really loving yourself, because that's where it really comes back to, right? You're not in this alone. We're in this together. And know that I love you. I believe in you, and I'm sending hugs your way. Be well.
I know the girl